As the discourse on hepatitis elimination deepens, it becomes increasingly clear that success depends not only on biomedical interventions, but also on sustained political leadership and governance. Political commitment determines whether hepatitis remains a neglected disease or becomes a national priority integrated into health and development agendas. Countries that have made measurable progress against hepatitis have done so by translating global commitments into concrete national strategies, supported by legislation, financing, and institutional accountability. Where political will is weak or inconsistent, hepatitis programs often remain fragmented, underfunded, and vulnerable to disruption. Governance structures influence how resources are allocated, how services are delivered, and how effectively policies are implemented. Strong governance ensures coordination between ministries of health, finance, education, and social services, recognizing that hepatitis control requires multisectoral action. Weak governance, by contrast, leads to duplication of efforts, inefficiencies, and gaps in coverage. Transparency in decision-making and accountability to citizens are therefore essential components of an effective hepatitis response. International organizations and global partnerships play a significant role in shaping the hepatitis agenda, providing technical guidance, mobilizing resources, and facilitating knowledge exchange. The leadership of the World Health Organization has been particularly influential in elevating viral hepatitis as a global health priority, setting elimination targets, and developing evidence-based guidelines. However, global guidance alone is insufficient without local adaptation and ownership. National and subnational actors must interpret and implement recommendations in ways that reflect local epidemiology, health system capacity, and sociocultural context. Financing mechanisms are central to sustaining hepatitis programs over time. Short-term donor funding, while valuable for initiating programs, cannot substitute for long-term domestic investment. Sustainable financing requires integrating hepatitis services into routine health budgets and insurance schemes, ensuring predictable funding streams that support prevention, diagnosis, treatment, and monitoring. Economic evaluations consistently demonstrate that investing in hepatitis elimination yields substantial returns through reduced healthcare costs and increased productivity. Yet translating this evidence into budgetary decisions remains a persistent challenge. Cost considerations influence not only whether services are provided, but also how they are delivered. Simplified models of care that reduce reliance on specialized facilities and personnel can lower costs and expand access. Task shifting to trained nurses or community health workers, decentralized testing and treatment, and standardized treatment protocols have all been shown to improve efficiency without compromising quality. These approaches are particularly important in settings with limited specialist capacity and high disease burden. Procurement and supply chain management are often overlooked but critically important aspects of hepatitis control. Interruptions in the supply of vaccines, diagnostic tests, or antiviral medications can undermine trust in health systems and lead to treatment failure or resistance. Strengthening procurement systems, forecasting demand accurately, and leveraging pooled purchasing arrangements can improve reliability and affordability. Regional collaboration and market-shaping strategies have proven effective in reducing prices and increasing availability of hepatitis commodities. The integration of hepatitis services with other disease programs offers additional opportunities for efficiency and impact. Given the shared transmission routes and affected populations, integrating hepatitis testing and treatment with HIV and sexually transmitted infection services is both logical and effective. Similarly, linking hepatitis screening to tuberculosis programs, antenatal care, and non-communicable disease services can increase reach and normalize testing as part of routine healthcare. Such integration reduces stigma by framing hepatitis as a standard health issue rather than an exceptional or shameful condition. Monitoring and evaluation are essential for ensuring that hepatitis programs achieve their intended outcomes. Robust indicators, regular data collection, and timely feedback enable program managers to identify bottlenecks, adapt strategies, and allocate resources more effectively. However, data systems must be designed to capture not only outputs, such as numbers tested or treated, but also outcomes and impact, including reductions in incidence, morbidity, and mortality. Qualitative data, including patient experiences and community perceptions, provide valuable insights that quantitative indicators alone cannot capture. The role of laboratories in hepatitis control merits particular attention. Accurate diagnosis and monitoring depend on reliable laboratory services, yet laboratory capacity remains unevenly distributed, particularly in rural and resource-limited settings. Investments in laboratory infrastructure, quality assurance, and workforce development are therefore essential. Innovations such as dried blood spot testing and point-of-care technologies offer promising solutions for expanding access while reducing dependence on centralized laboratories. Ethical considerations related to testing and disclosure are especially important in the context of hepatitis. Informed consent, confidentiality, and counseling are fundamental principles that must guide testing practices. Mandatory testing without adequate safeguards can exacerbate stigma and discrimination, undermining trust in health systems. Voluntary, confidential testing, accompanied by appropriate counseling, empowers individuals to make informed decisions and facilitates linkage to care. Treatment adherence and long-term engagement in care present ongoing challenges, particularly for chronic hepatitis B, which often requires lifelong therapy. Supporting adherence requires a combination of patient education, simplified treatment regimens, and supportive health system structures. Peer support groups, reminder systems, and community-based follow-up have all been shown to improve adherence and retention in care. Addressing social and economic barriers, such as transportation costs and competing priorities, is equally important. The psychological dimensions of living with hepatitis are often underestimated. Diagnosis can trigger fear, anxiety, and uncertainty, particularly in settings where information about the disease is limited or distorted. Mental health support should therefore be integrated into hepatitis care, recognizing the bidirectional relationship between mental well-being and physical health. Addressing mental health needs not only improves quality of life, but also enhances treatment adherence and outcomes. Cultural beliefs and practices shape perceptions of hepatitis and influence health-seeking behavior. In some communities, traditional healers or alternative therapies may be the first point of contact for individuals experiencing symptoms. Engaging with traditional health practitioners and incorporating culturally appropriate messaging can help bridge gaps between biomedical and traditional systems, promoting timely referral and acceptance of evidence-based care. Respectful dialogue and collaboration are more effective than dismissive or confrontational approaches. The role of the private sector in hepatitis control is complex and context-dependent. In many countries, a significant proportion of healthcare is delivered through private providers, who may offer testing and treatment services outside the public system. Engaging private providers through regulation, training, and partnerships can expand coverage and improve quality, but also requires oversight to prevent exploitation, overcharging, or inappropriate care. Public-private collaboration, when well designed, can contribute to more comprehensive and equitable service delivery. Workplace policies and programs represent another underutilized avenue for hepatitis prevention and care. Employers can play a role by providing education, facilitating access to vaccination and testing, and protecting employees from discrimination. Workplace-based interventions are particularly relevant in industries with higher risk of exposure, such as healthcare, construction, and transportation, as well as in settings where workers have limited access to formal healthcare services. Education systems also have a role to play in shaping long-term hepatitis outcomes. Incorporating age-appropriate information about hepatitis and liver health into school curricula can build knowledge and reduce stigma from an early age. Schools can also serve as platforms for vaccination and health promotion, particularly in regions where school attendance is high. Educating young people empowers them to make informed choices and contributes to sustained prevention over the life course. Environmental and occupational factors contribute to liver disease burden and interact with viral hepatitis in complex ways. Exposure to hepatotoxic chemicals, aflatoxins in food, and environmental pollutants can exacerbate liver injury in individuals with hepatitis. Addressing these risks requires coordinated action across environmental health, agriculture, and labor sectors. Reducing exposure to environmental toxins not only benefits individuals with hepatitis, but also improves population health more broadly. The global movement toward hepatitis elimination has generated valuable lessons about collaboration and solidarity. Countries that have achieved significant progress often share common features, including strong leadership, inclusive policies, community engagement, and sustained investment. At the same time, each country's path reflects its unique context, demonstrating that there is no one-size-fits-all solution. Learning from diverse experiences and adapting strategies accordingly is essential for global success. Humanitarian settings present particular challenges for hepatitis control. Conflict, displacement, and natural disasters disrupt health services, increase vulnerability, and complicate surveillance and follow-up. Integrating hepatitis services into humanitarian health responses and ensuring continuity of care for displaced populations are critical but often overlooked priorities. Flexible, adaptable approaches that account for instability and resource constraints are needed to protect vulnerable populations in these contexts. As elimination efforts advance, attention must also be paid to sustaining gains and preventing resurgence. Even after incidence declines, ongoing surveillance, vaccination, and treatment are necessary to maintain control. Complacency can lead to resurgence, particularly if funding or political attention wanes. Building resilient systems capable of adapting to changing circumstances is therefore essential for long-term success. The narrative of hepatitis is evolving from one of neglect and inevitability to one of possibility and action. This shift reflects decades of scientific progress, advocacy, and the lived experiences of millions affected by the disease. Yet the transition from possibility to reality requires continued effort, vigilance, and commitment. Elimination is not a single event, but a process that unfolds over time, shaped by choices made at every level of society. In reflecting on the broader implications of hepatitis control, it becomes clear that the fight against hepatitis is emblematic of broader struggles for health equity and social justice. It challenges societies to confront stigma, invest in prevention, and ensure that the benefits of scientific progress are shared by all. Success in eliminating hepatitis would demonstrate the power of collective action and the feasibility of addressing complex global health challenges through sustained, coordinated effort. As the global community moves forward, maintaining a focus on people rather than pathogens will be essential. Hepatitis elimination is ultimately about improving lives, reducing suffering, and enabling individuals and communities to thrive. Policies and programs must therefore remain grounded in empathy, respect, and a commitment to leaving no one behind. By keeping these values at the center of the response, the goal of a world free from the burden of hepatitis comes within reach. As hepatitis elimination efforts mature, attention increasingly turns to the sustainability of interventions and the long-term transformation of health systems. Sustainability requires moving beyond time-limited projects toward institutionalized practices that endure regardless of political cycles or funding fluctuations. This shift demands that hepatitis prevention, diagnosis, and treatment become routine components of healthcare delivery, supported by stable financing, trained personnel, and reliable supply chains. When hepatitis services are normalized in this way, they become less vulnerable to disruption and more resilient to external shocks. Health workforce development is a cornerstone of sustainability. Skilled and motivated healthcare workers are essential for delivering high-quality hepatitis services at scale. This includes not only physicians and specialists, but also nurses, midwives, laboratory technicians, pharmacists, and community health workers. Task sharing and task shifting strategies can optimize workforce capacity by enabling trained non-physician providers to deliver certain services, such as testing, counseling, and routine treatment follow-up. These approaches have been shown to expand access, particularly in rural and underserved areas, while maintaining safety and effectiveness. Retention of healthcare workers is equally important. High turnover undermines continuity of care and erodes institutional knowledge. Addressing workforce retention requires fair compensation, supportive working conditions, opportunities for professional development, and recognition of contributions. In many low-resource settings, healthcare workers face heavy workloads, limited resources, and occupational risks, including exposure to hepatitis. Ensuring their protection through vaccination, infection control measures, and occupational health services is both an ethical obligation and a practical necessity. Community ownership of hepatitis programs enhances sustainability and effectiveness. When communities are actively involved in program design, implementation, and evaluation, interventions are more likely to be culturally appropriate, acceptable, and responsive to local needs. Community leaders, patient advocates, and peer educators can play pivotal roles in promoting awareness, encouraging testing, and supporting adherence. Empowering communities also helps counter stigma by fostering open dialogue and collective responsibility for health. The role of data and evidence in sustaining hepatitis efforts cannot be overstated. Continuous learning and adaptation depend on timely, high-quality data that inform decision-making at all levels. Program managers require accurate information to identify gaps, allocate resources, and refine strategies, while policymakers need evidence to justify ongoing investment. Building a culture of data use within health systems strengthens accountability and supports continuous improvement. Equity considerations remain central as elimination efforts progress. Early gains often occur among populations that are easiest to reach, such as those already engaged with healthcare services. However, the remaining burden increasingly concentrates among marginalized groups who face complex barriers to care. Reaching these populations requires targeted strategies, flexible service delivery models, and partnerships with organizations that have established trust within communities. Without such efforts, elimination goals risk being achieved on paper while leaving significant pockets of unmet need. The economic case for hepatitis elimination becomes even stronger over time as benefits accumulate. Reduced incidence and mortality translate into lower healthcare costs, increased productivity, and improved quality of life. Longitudinal studies demonstrate that investments in vaccination and early treatment yield substantial savings by preventing expensive complications such as cirrhosis and liver cancer. Communicating these economic benefits effectively to finance ministries and policymakers is essential for securing sustained funding. Global solidarity and cooperation continue to play a vital role in advancing hepatitis elimination. Many countries benefit from shared resources, technical assistance, and collective bargaining mechanisms that lower costs and improve access to medicines and diagnostics. Regional initiatives and South collaboration facilitate knowledge exchange and capacity building, enabling countries to learn from one another's successes and challenges. Maintaining and strengthening these collaborative networks is essential for addressing transnational issues such as migration, supply chain disruptions, and emerging threats. The private sector's role in innovation and service delivery remains significant. Pharmaceutical companies, diagnostic manufacturers, and technology firms contribute to the development of new tools and approaches that can accelerate elimination. At the same time, ethical engagement with the private sector is necessary to ensure that profit motives do not undermine access or equity. Transparent pricing, voluntary licensing, and public-private partnerships aligned with public health goals can help balance innovation with affordability. Media and communication strategies influence public perception and political prioritization of hepatitis. Sustained media coverage can raise awareness, reduce stigma, and hold decision-makers accountable. However, messaging must be accurate, nuanced, and sensitive to avoid sensationalism or unintended harm. Engaging journalists, communicators, and influencers as partners in health promotion can amplify positive narratives and counter misinformation. The integration of hepatitis elimination into broader liver health strategies offers opportunities for synergy and efficiency. As non-viral liver diseases, such as alcohol-related liver disease and metabolic-associated fatty liver disease, rise globally, comprehensive liver health approaches become increasingly relevant. Integrating screening and prevention efforts across liver diseases can streamline services, improve detection, and address shared risk factors. This holistic perspective recognizes the interconnected nature of liver health and supports more sustainable health system responses. Research translation remains a critical challenge and opportunity. Bridging the gap between scientific discovery and real-world impact requires deliberate efforts to disseminate findings, update guidelines, and train providers. Implementation